I perform direct anterior hip replacement. It is a minimally invasive, muscle-sparing approach or technique that is difficult to learn. It is not something that everybody performs or offers. Luckily for me, I got started on it when I was an intern in my first year of residency. My mentor in residency, who was a joint specialist, had just started learning how to do it. There is a learning curve when you're learning how to do this procedure. It's in this research studies, it's quoted somewhere between 50 and 100 cases. So I was very lucky to learn it, not on my patients, because there are some small complications that happen when you're learning a new technique. It's kind of inevitable. So for those 5 years, I got to do both anterior and posterior hip replacements, but I really enjoyed the anteriors. I really saw the patients have much better outcomes, much less pain, much quicker recovery. So it was something that I really enjoyed, and to be honest with you, it's still my favorite surgery to do. When I went to fellowship, I was not going to go to a fellowship that didn't continue to offer anterior hip training, because I was going to do the majority of my hips that way. There's no way I was going to spend a year in advanced training and further training and not continue to hone that skill. The anterior hip has a lot of benefits when it comes to the patient. Number one, it's muscle sparing, which means we don't cut any muscle. When we make our incision, we move the muscles to the side and we go in between them. So there's much less muscle damage, much less soft tissue damage, much less inflammation, which means less pain, quicker recovery, less need for pain medications, quicker return to work, quicker return to activities. These are all backed up in research studies. The other part of anterior hip replacement that is a huge benefit is when in the post-operative period, you don't have to worry about any leg position precautions. Leg position precautions are something that when you've had a hip replacement, there are certain positions or certain things you can't do because you are putting your hip at risk of dislocating. When we do your surgery, we do have to dislocate the hip to perform the surgery. Whatever way we do the surgery, whether it be anterior or posterior, there are certain positions that you have to avoid. With the anterior hip, there basically are no positions that you have to avoid. I have seen one lady dislocate her hip in my training, and it was because she was doing an extreme position in a yoga class. So I do warn my patients, if you do yoga, you do have to stay away from this position, but most of my patients don't do yoga, so I don't have to worry about that. But that is a huge benefit, because for the rest of your life, you can sleep however you want, you can sit in whatever type of chair you want, you can cross your legs, tie your shoes. There really are no activities that you have to be worried about with the anterior hip. The last benefit, in my opinion, of the anterior hip is the positioning of the components. If you don't use any technology and you're just doing manual surgery. In an anterior hip, you are lying on your back, which is called the supine position. So it's very easy and accessible to bring an x-ray machine in and out during the surgery while you're placing the components. So I am able to confirm that the position of my components that I'm putting in are accurate and precise and correct, and I'm able to confirm that we have reestablished the patient's leg length and that they're equivalent to the other side, which is a huge deal when you have a hip replacement. The two goals are to restore your leg length and what's called your offset. The number one reason why joint replacement surgeons are sued in today's world is a leg length discrepancy, meaning that you went into surgery at a certain length of your leg, and when you came out, it's either extremely short or extremely longer than it was and compared to the other side. So the anterior hip really allows us to block against that, because I can get a live x-ray and make sure all those things are perfect before we even start closing the incision. You add on to that the robotic assisted anterior hip, and it's even better.